Hello and welcome to the first episode of my podcast. So, for this episode, I wanted to talk about adolescent mental health as it relates to our language and the stigmatization surrounding it. For this topic, I really use the post structural lens as I believe it highly relates to the language we are using as well as the actions that follow. So, the first article I read was entitled Psychosocial Outcomes of Mental Illness Stigma in Children and Adolescents and was a systematic review. This article begins by highlighting that an estimated 1 in 5 young adults experience a mental health illness. Despite this fact, the utilization of mental services goes underutilized. For young adolescents, a barrier to accessing treatment is the usage of stigmatizing language, which is highly derogatory towards the illness. Stigma can be classified as a characterizing trait into the identity of abnormal and creating a stereotype which can be assigned in society. When an individual experiences stigma, this can often result in a decrease in self-esteem, feelings of shame, and a decrease in ability or likelihood to disclose illness or seek treatment for fear of being stigmatized. One thing I liked about this article is it gave insight into language young adults often prefer when being treated or being seen regarding a mental health concern. This article states that a lot of young adults prefer language which is less diagnostic and more generic. I believe this is very insightful, as well as this is something we could incorporate into our practice. It is also something we could refocus our lens on, as we can prioritize the preferred language of the patient. This can involve asking questions and active listening into how they would like their healthcare experience to go. This article additionally mentions why stigmatization can be also very detrimental to young adults, as this relates to their developing social identities and social capital that are newly forming. It also mentions how young adults are less likely to want to be labeled within the category of mental illness due to the high prevalence of fear that they will be solely seen within the scope of the illness. This is something we need to be considerate of in our practice, as we can remind individuals that any sort of mental illness or disorder does not make up them as a whole, and we will be treating them holistically. The second article I read focused on the idea of stigmatization and discrimination within the community, specifically related to young Black Canadians. This article mentions the disproportionately high prevalence of mental health difficulties within these communities. It is disproportionately high given the prevalence of a multitude of factors, including systemic barriers such as a decrease in access to practitioners, geographical difficulties and transportation, as well as financial barriers. Another barrier that includes for this population includes the fear of systemic racism and discrimination from providers and their inability to provide culturally competent care. To me, the intersectionality of culturally competent care as well as stigmatization is something we need to be highly considerate of when treating this population. Our language within these areas is highly important and sensitive, as we want to create a safe, culturally competent space where individuals do not fear stigmatization and discrimination. To further amplify this, we need to look through a post-structural lens as well as a post-colonial lens, as we need to be able to utilize patient-centered and holistic care and give these Canadians the care that they deserve and require.